So you talked on a very, very relevant topic, the impact of chemotherapy used for cancer management on cardiac things. So first my question will be, sir, is cancer curable in today's date?
Today's scenario with the introduction of surgery, chemotherapy, radiotherapy all together taken, now the longevity of these cancer patients has increased to the extent of cure.
True.
So in that context, we have to treat them what are the things that is coming up because of longer longevity in a cancer patient. Earlier we had a belief that they die very quickly, so we don't think about what is their heart problem.
Right.
So today, because of the drugs that you use for treating cancer and prolonging life, that has come up with some side effects. So that impact has led to some diseases of the heart.
So what are the major problems of chemotherapy on the cardiovascular disorders?
So once we use the anthracycline group of drugs or newer drugs, the targeted drugs, they lead in course of time they go to heart failure,
Okay.
heart dysfunction, different varieties of irregularities of heart or arrhythmias, in some cases hypertension, some cases hypotension. So varieties of problem they come up once the longevity is increasing. So they have to be treated, not to be ignored. So this is the area now, it is called Unko cardiology, means the cardiologist and the oncologist has to sit and plan for a better qualitative life of the cancer patient, rather than earlier as you're ignoring his life is short, so why do bother about a heart disease?
So how do we manage these effects?
This we have very small trials, very small studies, because the cardiologist we are not very much concerned about these patients earlier. Today we have become alert. We have good drugs, particularly besides the heart failure drugs that you are using routinely like digoxin, diuretics and other things. Today we have good data to say with the SE inhibitors, which can be given for prevention, treatment, follow-up. It has now a good data. Carvedilol has a very good track record from the beta blockers, and it is can be given because it is not only a beta blocker, it is also a good antioxidant for these patients with chemotherapy toxicity that is coming with free radicals.
Right.
So it looks wonderful that we can prolong their life, we can give them a good qualitative life today.
So thanks, sir. I think that's a very, very relevant subject in these days, because as you correctly said, that patient life has increased because of improved in chemotherapeutical drugs. But at the same time, these drugs could have cardiovascular side effects, and physicians need to be very vigilant about these effects and monitor and manage these effects in a very, very effective manner.
It's relevant. Every doctor has to be alert, because when the patient lives long, he goes back to also a general physician.
Correct.
So the general physician has to not ignore that the breathless is just a casual thing.
Correct.
It can be a dilated cardiomyopathy because of the impact of the drugs taken 5 years back.
Right.
You are given anthracycline 5 years back, now he comes with a breathlessness.
True.
So don't ignore it. Treat it in the proper perspective of cardiology.
Thank you, sir. Thanks a lot for joining and sharing your views with us. Thank you, sir.
Thank you, Rishi.
In today's date?
Today's scenario with the introduction of surgery, chemotherapy, radiotherapy all together taken, now the longevity of the